that now.
Your nose is bleeding. I can help.
Nosebleeds can occur when small blood vessels inside the nostrils are ruptured. Most nosebleeds are not serious and can be easily handled. To care for someone with a nosebleed, have her sit up straight with her head tilted forward, chin down. Pinch the soft portion of the nose with your thumb and index finger and hold it for about 10 minutes. Don't tilt the head back or have the person lie down. These actions may cause her to swallow blood and vomit. Have her spit out any blood that collects in her mouth. Monitor the person. If the nose continues to bleed or you see signs of developing shock, seek further medical help. A blow to the mouth can break, dislocate, or even knock out teeth.
I think if we shuffle things around a little bit, we can get that to you by next month.
Okay, I'll let him know.
All right, sounds great.
I'm so sorry.
Alan, are you okay?
When a tooth has been knocked out, treat it without delay. Immediate reimplantation is believed by the dental community to result in the greatest chance of tooth survival. Control any bleeding. Have the person gently bite down on a clean, absorbent pad over the bleeding socket. Handle the tooth only by the chewing surface, called the crown. Do not touch the root, the part of the tooth that extends into the gum. Never scrub the tooth or remove any attached tissue fragments. Keeping the tooth moist can help extend the time for successful reimplantation. At a minimum, have the person spit into a cup and place the tooth in the saliva. Avoid storage in water. There are alternative solutions that are more effective for temporary storage of a displaced tooth than saliva. Hank's balanced salt solution, egg white, coconut water, whole milk. Get the person to a dentist as quickly as possible, within an hour. The faster you act, the better the chance of saving the tooth. Medical conditions and illnesses can suddenly trigger an unexpected medical emergency.
Good morning, Rick. How are you? Whoa, are you okay?
I don't know. All of a sudden, I just feel awful.
Okay, well, I can help. Is that okay? Tell me more about what...
In general, suspect a serious illness when, without warning, a person suddenly appears weak, ill, or in severe pain. In many cases, the human body displays warning signs to alert us to serious illness. The most common warning signs of serious illness are an altered mental status, breathing difficulty or shortness of breath, and pain, severe pressure, or discomfort in the chest.
Carl, are you okay? Let me help you, okay?
Caused by a number of medical conditions, as well as the use of alcohol, medications, or drugs, an altered mental status is a significant or unusual change in a person's personality, behavior, or consciousness. It is an indication of a change in brain function.
Carl, do you know what's going on?
Regardless of the cause, an altered mental status is a warning sign of a serious problem and is considered a medical emergency. Activate EMS.
Side parking lot. I need EMS right away. And can you send somebody out with first aid kit?
Position the person for comfort. Calm and reassure him as best you can. If responsiveness becomes severely diminished, consider placing in a recovery position to protect the airway. Reassess regularly. The condition could deteriorate quickly and require additional care.
Hey, are you ready to get something to eat?
Yeah, I'm not having much luck with finding what I need.
Whoa.
Fainting is a momentary loss of consciousness caused by an unexpected drop in blood pressure and blood flow to the brain. Anxiety, fear, pain, stress, standing in place too long, or rapid movements in position, such as standing up quickly from a seated or lying position, can all result in someone feeling faint or fainting. A medication or underlying medical condition might also contribute to the cause. If someone complains of suddenly feeling warm, lightheaded, or that his or her vision is narrowing, quickly lie her flat on her back on the ground. You can elevate the feet about 6 to 12 inches, which allows blood from the legs to move back into the body. Do not elevate the feet if it causes pain or you suspect a person may be injured. This is a temporary condition that should pass quickly and allow the person to get back to normal activities.
A stroke, or brain attack, occurs when the blood supply to a portion of the brain is suddenly interrupted.
Somebody, we need help.
Sir? Madam? I'm Ellen and I work for the winery. Is something wrong?
I don't know what happened to him.
I can help.
A stroke most commonly occurs when a blood clot obstructs a blood vessel in the brain. A stroke can also occur when a weak spot in a blood vessel wall, known as an aneurysm, bursts open and bleeds into surrounding brain tissue. Signs of a stroke can vary depending on where the damage is located. The signs tend to show up suddenly. Numbness or weakness of the face, arm, or leg, especially on one side of the body. Confusion. A change in the ability to speak or understand. Changes in sight and balance. A severe, sudden headache. Early bystander recognition, along with rapid transport to a hospital, is critical for limiting damage or even survival. Medications are available at hospitals that can limit the severity of a stroke. The earlier they can be given, the better. A simple stroke assessment, such as FAST or FAST, helps decrease the time it takes to suspect a stroke, activate EMS, and get a person treated in a hospital.
Sir, can you try and do a few things for me?
F.
Okay.
Face droop.
Smile for me?
Ask the person to smile.
If you can.
Look to see if the smile is uneven.
Good. Now can you raise both of your arms?
A. Arm drift. Ask the person to raise both arms. Look to see if one drifts back down.
Can you tell me your name?
S. Speech difficulty. Ask the person to speak a simple sentence. Listen for slurring or difficulty. T.
I think we need
Time to activate EMS.
Troy, go call 911.
If the person has trouble with any of these tasks, activate EMS immediately. Report the time the person was last seen normal to EMS personnel. Overall, do not give anything to eat or drink. Be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED. Stay close, calm, comfort, and reassure the person until another provider or EMS personnel take over. Diabetes is a disease in which the body cannot effectively use sugar for energy. Hypoglycemia, or low blood sugar, is a diabetic condition that can rapidly develop and become life-threatening. Early recognition and treatment by a first aid provider can prevent the condition from worsening.
Hey, are you okay?
No. I need to get started on this. I'm not sure how.
Suspect hypoglycemia with anyone who begins to act oddly or becomes confused. The person may be trembling or shaking, and his skin may be pale, cool, and sweaty. If the person is unable to communicate clearly, look for a medical alert bracelet or necklace, which may help identify the underlying condition. You can also check with others about the person's medical history or medications he may be taking. If someone is unresponsive, unable to follow simple commands, or has difficulty swallowing, quickly activate EMS and provide any required supportive care. Do not give anything to eat or drink.
Hey, Anna, can you come over here? Do you have your glucose with you?
My coat.
What's up?
I think Jerry's having a problem with his diabetes. Can you run to the break room and grab his coat? He has some sugar tablets in one of the pockets.
If the person is responsive and can swallow without difficulty, give about 15 to 20 grams of oral glucose tablets if they are available. If not available, use something with dietary sugar instead, such as orange juice, candy, fruit leather, or whole milk. Things that use artificial sweeteners will not help. It is important to note that insulin is not considered an emergency medication. It is never appropriate to administer insulin to a diabetic person in an emergency setting. Calm, comfort, and reassure the person. If he responds to the sugar, his mental status will gradually improve. If there is no response to sugar within 10 to 15 minutes, or the condition worsens, activate EMS and provide additional glucose or sugar. Reassess regularly until another provider or EMS personnel take over.
Eduardo?
Generalized seizures are triggered by excessive electrical activity within the brain.
Eduardo!
The result is uncontrolled muscle convulsions throughout the body.
Hey! Somebody help! Help!
Typically, seizures happen without warning. Jerking movements of the body occur and breathing may seem absent. The person can lose control of his bowel or bladder and may vomit.
I can help.
While there are many things that can cause a seizure to occur, the care provided is always the same. Protect the person from injury during the seizure. Move objects away that he may bump into. Do not restrain the person. Allow the seizure to take its course. If possible, roll the person onto his side to allow saliva to drain from the mouth. Do not put anything in the mouth, including your finger. There is no danger of the tongue being swallowed.
Has he had a seizure before?
I don't think so.
Go call for EMS and get the first aid kit and AED from the break room.
Activate EMS if the person is injured or vomits during the seizure, has no history of seizure, has multiple seizures, or continues to seize for more than 5 minutes. Most seizures last only a short time and will stop without any special treatment. Once stopped, place the person in the recovery position to protect the airway. If responsiveness and breathing are absent after a seizure stops, begin CPR and use an AED if one is available. Normally, once a seizure stops, responsiveness improves slowly over time. Provide continual reassurance as the person improves. Provide privacy to minimize embarrassment. Continue to monitor until EMS personnel take over care or the person returns to normal.
Breathing difficulty or shortness of breath is a medical emergency. It is generally caused by an underlying medical illness such as asthma, allergic reaction, heart failure, or lung disease. At rest, normal breathing is regular and effortless. You may first suspect difficulty when there is a noticeable increase in the effort to breathe and the rate at which breaths are occurring. Coughing or unusual breathing sounds may occur.
Dale, what's wrong? Are you okay? Here, let me help. Come sit down.
A bluish-purple tissue color, especially in the lips or fingers, indicates a developing lack of oxygen and is a serious warning sign.
I think we should call for some help, okay?
Do not wait to see if a person's condition will improve. Activate EMS without delay.
Yes, I have a coworker here that's having a hard time catching his breath. Yes?
If an AED is available, have someone get it.
First aid kit and the AED, please.
Allow the person to find the most comfortable position in which to breathe. Loosen any tight clothing. Breathing difficulty can quickly become life-threatening as a person becomes exhausted from the breathing effort. Be prepared to provide CPR and attach an AED if breathing stops. Reassess regularly until another provider or EMS take over.
Adam? Are you okay? I can help. Okay? Is
it your asthma?
Asthma is a medical condition in which certain things can trigger a physical reaction in the lungs and make it difficult for a person to breathe. In an asthma attack, the small airway in the lungs become narrow due to swelling and the production of mucus. Airflow into and out of the lungs becomes restricted. Asthma triggers include allergens such as pollen and molds, irritants such as smoke, fumes, and dust, medications such as aspirin or acetaminophen, extreme weather conditions, exercise, stress.
Do you have an inhaler?
Quick relief medications delivered with an inhaler device work fast to help control asthma symptoms. If the person has a prescribed inhaler for asthma, assist her in using it. Remove the cap on the mouthport and shake the inhaler well. Have the person sit up with her head back slightly. Holding the inhaler upright, instruct her to breathe out all the way and then place the mouthport of the inhaler between her teeth, sealing her lips around it. While breathing in slowly and deeply, have her press down once on the inhaler canister to release the medication. Have her remove the inhaler and hold her breath for at least 5 to 10 seconds to help the medicine get deep into the lungs. Repeat as directed by the dosage instructions on the medicine canister. A spacer is a device that can help deliver medication more effectively. Use one if it is available. Monitor the person for any changes in his condition. Activate EMS immediately if the symptoms seem serious, get worse, or if there is no response to the medication within 5 minutes.
A severe allergic reaction, known as anaphylaxis, is an extreme response to the body's immune system to something it is sensitive to.
I got stung.
Common things that can initiate a severe reaction include bee stings, peanuts, latex, and penicillin. When anaphylaxis occurs, the airway can become constricted due to swelling of the throat, making it difficult to breathe. Wheezing may be heard. Swelling of the lips, eyelids, and face may occur. Itchy raised lumps or hives can appear on the face and chest. The person may complain of nausea and abdominal cramping. A severe allergic reaction can develop rapidly. In general, the faster the reaction occurs, the more severe it is. Without treatment, death can occur within minutes. Activate EMS. Allow the person to find the most comfortable position in which to breathe. A person with a history of allergic reactions may carry a prescribed epinephrine auto-injector. Epinephrine can quickly reverse the effects of the reaction and may be life-saving. Auto-injectors use a spring-loaded needle to rapidly administer a measured single dose of epinephrine. They are easy to use with minimal training. If the person has an auto-injector available, assist him in using it on himself. If the person has not responded to an initial dose of epinephrine and EMS is still at least 5 to 10 minutes away, a second dose may be given. Reassess regularly until another provider or EMS personnel take over. When a person is unable to self-administer an injection, you may be able to do it for him. Your state law must allow for you to do so, and proper training is generally required to meet the regulation. The EpiPen epinephrine auto-injector is a commonly used delivery device. Available in both adult and child dosages, the EpiPen is designed to work through clothing. To use, remove the EpiPen from its storage container. Never put your thumb, fingers, or hand over the orange tip. Form a fist around the injector and pull off the blue safety release cap. Position the EpiPen near the middle of the person's outer thigh. Swing and firmly push the orange tip at a 90-degree angle against the thigh so it clicks. Hold the injector firmly on the thigh for approximately 10 seconds to deliver the epinephrine. Pull the injector straight out. The needle will retract underneath the safety cap. Firmly massage the injection area for about 10 seconds. Carefully place the used EpiPen somewhere safe. Give it to EMS providers for proper disposal. Consider giving a second dose with a new EpiPen if symptoms persist and EMS is still 5 to 10 minutes away. When a person is unable to self-administer an injection, you may be able to do it for him. Your state law must allow for you to do so, and proper training is generally required to meet the regulation. Epinephrine auto-injectors are designed to work through clothing. To use, remove the epinephrine auto-injector from its storage container. Form a fist around the injector and pull off the cap marked 1 to reveal the red tip. Pull off the end cap marked 2. Never put your thumb, fingers, or hand over the red tip. Put the red tip against the middle of the person's outer thigh. Firmly push the tip in at a 90-degree angle so it clicks. Hold the injector firmly on the thigh for approximately 10 seconds to deliver the epinephrine. Pull the injector straight out. Check the red tip. If the needle is exposed, the epinephrine was delivered. If the needle is not visible, attempt to deliver the epinephrine again. Carefully place the used auto-injector needle first into the storage container to prevent an accidental needle stick to another person. Give it to EMS providers for proper disposal. Consider giving a second dose with a new epinephrine auto-injector if symptoms persist and EMS is still 5 to 10 minutes away.
Acute coronary syndrome, or ACS, occurs when there is reduced blood flow to the tissues of the heart.
Oh man, you don't look so hot.
Often described as a heart attack, ACS is a serious condition that can result in significant damage to the heart.
I can help, okay?
Someone with ACS will generally experience pain, pressure, or discomfort in the chest. Women often do not experience chest discomfort and may describe indigestion, weakness, or fatigue. Shortness of breath, nausea, and lightheadedness can also occur. The person may experience pain in the arms or back. The person's skin may become cool, pale, and sweaty.
Jenna, can you come in here, please?
A person who has had previous heart problems is at risk for reoccurrence. Ask the person or any bystanders about prior problems or medications being taken.
Has this happened before?
Yeah.
Hey, listen, I think we should call for some help.
If you suspect a heart-related problem, do not try to transport the person to a hospital yourself. Activate EMS immediately.
Call EMS, tell them that we have someone
If an
with chest
AED
pain.
is available, have someone get it so that it's nearby if needed. Allow the person to find the most comfortable position in which to breathe. Loosen tight clothing. Calm, comfort, and reassure the person. A person who is having a heart attack may deny it. This is a common occurrence in this situation. Accept it, but never let this alter your approach to care. The early administration of aspirin can be life-saving for a person having a heart attack. While waiting for EMS providers to arrive, encourage the person to chew and swallow 1 adult 325 milligrams or 2 to 4 low-dose 81 milligrams baby aspirin. Do not encourage aspirin use if the person has an allergy to aspirin, evidence of a stroke, a recent bleeding problem, the pain does not appear to be related to the heart, or if you are uncertain or uncomfortable with giving the aspirin. Someone with a heart condition may carry a prescribed medication known as nitroglycerin. If so, assist the person in taking it. Whenever a heart attack is suspected, be prepared for the possibility of sudden cardiac arrest and the need for CPR and the use of an AED. Continue to reassure the person until another provider or EMS personnel take over.
Any substance that can enter the body and create a harmful reaction in the body can be described as a poison. By far, poisoning most often occurs by ingestion. Children under 6 years old account for over half of all poisonings. Common ingested poisons include prescribed medications, personal care products, and household cleaning products.
Ida! Hi! Are you ready to go down to the dining room for lunch? You don't look well. Are you okay?
The effects of ingested poisons are wide-ranging and often resemble those of common illnesses. Abdominal pain or cramping, nausea, and vomiting may occur. A person may have an altered mental status.
Did you take your medications this morning?
Yes, a while ago.
You have the wrong bottle open. Are you wearing your glasses?
Oh no.
If you suspect a person has ingested something poisonous, act quickly.
Oh, do you think I'm gonna be okay?
I don't know. Let's get some help.
Ida, is everything okay?
Ida may have taken the wrong medication this morning. She's not feeling well.
Okay, I can help.
We think this is what she may have taken by mistake.
I'm not supposed to mix that with my other medications.
Okay. I'm going to call the Poison Help Hotline to get more information on what we should do.
Yes, please.
Hi, I'm with Serenity Hills Retirement Center. We have a patient.
In the United States, calling the National Poison Helpline at 1-800-222-1222 automatically transfers you to a regional poison control center. Poison control centers can quickly provide information regarding the immediate treatment to exposure of any substance. Activate EMS if the person is displaying any serious signs or symptoms. You can help EMS providers and the Poison Control Center by clearly identifying the substance and providing details about the incident. Save any vomit, bottles, or containers for EMS. Do not administer anything by mouth for any poison ingestion, unless advised to do so by a Poison Control Center or EMS personnel. Keep the person still, calm, comfort, and reassure. Reassess the person regularly until another first aid provider or EMS personnel take over.
So I'm thinking we get started about 9 o'clock.
Okay.
Dale, is everything okay?
Inhaled poisoning occurs when a harmful substance is breathed in. Suspect inhaled poisoning whenever someone is working in an enclosed space and he is feeling ill.
Could be carbon monoxide. We need to get you.
Make sure it is safe for you to help. If you can do so without risk to yourself, immediately move the person to fresh air. Common inhaled poisons include carbon monoxide, natural gas, solvent fumes, and chemical vapors. A person may complain of a headache, nausea, dizziness, and difficulty breathing. An altered mental status can occur. Some poisons, such as natural gas, have a telltale odor. Other poisons, such as carbon monoxide, do not. Help the person to find a comfortable position.
John, call 911.
Activate EMS if the person is displaying any serious signs or symptoms. Call the National Poison Helpline at 1-800-222-1222 for additional directions on care. Help identify the substance and provide details about the incident. Reassess regularly until another first aid provider or EMS personnel take over.
Are you okay?
Severe abdominal pain may also be a warning sign of serious illness, especially if it appears suddenly or is a new experience for the person. There are many important organs in the abdomen. A wide variety of problems could occur and result in intense pain. It is impossible to accurately determine what the underlying cause is. Activate EMS without delay if the symptoms seem severe or you are not sure. Early suspicion and rapid transport to a hospital may help to prevent the development of a life-threatening condition. The abdomen may be rigid or tender to the touch. The person may become nauseated and vomit. A person complaining of severe abdominal pain will typically try to find a position of comfort, often with the knees raised to relieve the pain. Help the person to maintain this position. Provide calming reassurance until EMS personnel take over. Internal bleeding related to a pregnancy is one cause of abdominal pain. Light, irregular discharge of blood through the vagina or spotting is normal in pregnancy. However, significant bleeding, especially late in the pregnancy, is a serious medical emergency. Severe abdominal cramping and pain can occur. Her skin may become cool, sweaty, and pale in color. She may be weak and lightheaded. Activate EMS immediately. When lying face up, the baby puts pressure on the main vein that returns blood to the heart. Lay the mother on her left side to improve blood flow to both the mother and baby. Treat for shock. Help maintain a normal body temperature. Do not give anything to eat or drink. Calm, comfort, and reassure her. Reassess regularly until EMS personnel take over. Heat-related problems occur when a body's normal temperature-reducing mechanisms get overwhelmed and become inefficient or stop working.
Let's take a break. Let's go outside for a minute.
This is especially true during vigorous physical activity. When a person is exposed to warm, humid temperatures, internal body temperature begins to rise. Normally, the person reacts by sweating, which evaporates and pulls heat out and away from the body. Simply rehydrating someone suspected of being dehydrated due to physical exertion and sweating could prevent serious heat-related problems from developing. Drinking a carbohydrate electrolyte drink, such as a sports drink, works well to do this. Use water if a sports drink is not available. Heat exhaustion can occur as a combined result of a rising internal temperature and dehydration.
Hey, are you okay?
No, I'm not doing so good.
Signs include heavy sweating and pale, cool skin. The person can become nauseated and vomit. He may complain of a headache or dizziness and feel weak.
Let me help you, okay?
Yeah, all right.
Okay, let's get you out of here. You may be overheated.
All right.
Although it may not appear serious, treat heat exhaustion quickly. Without early recognition and treatment, it could progress to heat stroke, a life-threatening condition. Have the person stop any activity and move him to a cooler place. Loosen or remove excess clothing. Have the person lie down. If he is uninjured, consider raising his legs 6 to 12 inches. Do not elevate the legs if it causes pain or the person is injured. Spray water on or apply cool, wet cloths to the head and torso. Use a fan to increase the cooling effect. If the person is able to follow simple commands and swallow without trouble, encourage the person to drink fluids, preferably a carbohydrate and electrolyte sports drink. Use water if a sports drink is not available. Do not give anything to drink if shock is suspected, the person is confused, or he has difficulty in swallowing. In most cases, the person's condition will gradually get better. If the person does not improve or seems to get worse, activate EMS.
I called you to check on my neighbor, Mr. Ford. He usually comes to the door right away. I'm really worried about him in this heat.
Okay, I'll check him.
Heat stroke is a condition in which body temperature rises because the body's normal cooling systems are overwhelmed or simply shut down as a result of extended exposure to a hot environment.
Wait right here. Mr. Ford? Mr. Ford?
Heat stroke is a serious medical emergency and can quickly cause permanent damage to the brain.
Mr. Ford, I'm with the sheriff's office. I can help you, okay?
A person with heat stroke will be very warm, even hot to the touch. Heavy sweating could be present, but in many cases the skin can be red and completely dry. Typically, the person will be confused and could have trouble communicating. The person may become unresponsive and could experience a seizure. Activate EMS immediately. The most important action a first aid provider can take is to begin immediate cooling with the resources available. When possible, the best method for cooling is to immerse the person up to the chin in cold water. If immersion is not possible, spray or pour cold water on the person and fan him. Apply cold packs to the neck, groin, and armpits. Cover the person with a cold, wet sheet and continue fanning. Provide continuous cooling until EMS personnel take over care. With early recognition and effective cooling, most people suffering from heat stroke will survive. A cold or cool, wet environment can result in a lowering of internal body temperature. Hypothermia and frostbite are the most dangerous cold-related conditions.
Dispatch 749.
Go ahead, 749.
General check at Middles Boat Landing.
Copy, 749. General check at Middles.
Hi, I'm Richard with the Park Service. What's going on?
I don't think he's doing well. I'm worried about him.
Sir, what happened?
Hypothermia, a generalized cooling of the body, occurs when the internal core body temperature has decreased to 95 degrees Fahrenheit or less. It can be a life-threatening condition. Look for early signs such as pale, cold skin, uncontrollable shivering, and loss of coordination. As hypothermia progresses, shivering may stop, breathing and heart rate slow down, body process can become impaired and may fail. Remove wet clothing and cover him with something dry and warm. Activate EMS. Cardiac arrest could occur. Get an AED if one is accessible. To care for the person, move him to a warmer place. Move him slowly and without rapid movements. Cover his head and neck to retain body heat. If you are far from professional medical care, begin actively rewarming the person. Place him near a heat source. Put containers of warm, but not hot, water in contact with the person's skin. It is best to recognize and treat hypothermia early. The chance for survival decreases as the condition progresses.
How's your hand doing? I've been trying to get it warm, but my fingers are pretty numb. I probably should have took the wet glove off earlier.
Frostbite occurs when skin and underlying body tissue freezes. Body parts that are commonly exposed to extreme cold, such as the fingers, toes, earlobes, cheeks, and nose, are the most likely to be affected. Signs of freezing include a loss of feeling in the affected part and firm, pale, cold, numb skin.
See, you made it back in.
Lowering tissue temperature prior to freezing may cause a pins and needles sensation and throbbing. Freezing could be prevented by using a simple skin-to-skin rewarming technique, such as holding the affected part in a warm hand.
You need some help? Yes. My buddy's glove got messed up. Took it off, and now his fingers are numb. It took us a while to get here. Can I take a look? Sure.
Yeah, it looks like you may have frostbite. I can help.
Okay.
Why don't you put your hand back under your arm and let's come back to the truck.
If you suspect frostbite, quickly get the person to a warmer place. Remove any wet clothing. When EMS is close, or there is any chance that the part may refreeze, do not try to rewarm the frostbitten area. Do not rub or massage the affected area or disturb blisters on frostbitten skin. Remove all jewelry from the affected areas. Then place clean pads between frostbitten fingers and toes. Finally, wrap the affected part with a clean towel or pad. Keep the affected part still and protected. Provide ongoing reassurance until EMS providers can take over care. If you are far from professional medical care and there is no chance refreezing will occur, rewarm the affected part yourself. Immerse the frostbitten area in warm water for 20 to 30 minutes. The water should be warm, not hot, just above normal body temperature. Check and maintain the water temperature often. Severe burning pain, swelling, blistering, and color changes may occur. Do not let the person use the affected part after it is thawed. Get her to professional medical care as soon as you are able.
Caring for someone in an emergency can create emotional distress. Exposure to an extreme situation or having a close relationship with those involved can intensify these feelings. Common reactions include anxiety, trembling or shaking, sweating, nausea, fast breathing, and pounding heartbeat. This is a normal reaction to a traumatic event. Calm yourself as best you can and acknowledge your limitations as a provider.
Button now. Shock delivered.
When the emergency is over, a provider is often left alone while an ill or injured person is quickly transported away by EMS. With limited time for closure, you can begin to experience a variety of reactions. These include feeling abandoned or helpless, recalling the event over and over, self-doubt about not doing enough, difficulty concentrating, heaviness in the chest, upset stomach or diarrhea, and difficulty sleeping or nightmares. These feelings are normal and should pass with time. However, there are actions you can take to help work through the difficulty. Share your feelings. Informally talk with someone you trust who will listen without judgment, such as a family member, friend, or coworker. Get back to a normal routine as soon as possible. Accept that it will take time to resolve these emotions. If unpleasant feelings persist, formal assistance from a professional counselor may be helpful as you deal with your emotions about the event.
Many insects, such as bees, wasps, and fire ants, may sting when agitated or in defense of their nests or territories. While wasps and fire ants can sting repeatedly, the stinger of a honeybee detaches from its body, remains embedded in the skin, and continues to inject venom. If a stinger is present in the skin, remove it as quickly as possible. Local pain, redness, swelling, and itching generally occur at the sting site. Care for bites and stings by washing the site with soap and water. As a precaution for swelling, always remove jewelry from the affected area. Cover the area with an adhesive bandage or a pad. Use local cooling to help reduce swelling and pain. It is possible for a life-threatening allergic reaction to develop. Monitor for at least 30 minutes to see if condition worsens. If you think someone is developing a severe allergic reaction, immediately activate EMS. If he has an epinephrine auto-injector available, assist him in using it on himself. Only a few types of venomous snakes are found in North America.
I cut across the trail and I got bit by a snake.
Very few of the snake bites that occur are fatal. However, because fatalities have occurred, a suspected venomous snake bite should be considered and treated as a medical emergency. Venomous cottonmouths, copperheads, and rattlesnakes are known as pit vipers. Pit vipers strike once and leave a characteristic bite with a single or double fang mark. Pit viper bites can cause intense burning pain and rapid local swelling. If you suspect a pit viper bite, reassure the person that medical treatment is available. Have the person sit still to slow the spread of venom within the body. Activate EMS. Remove constricting items from the affected limb. Control any bleeding with a clean pad. Immobilize the injured part and keep it below heart level. Do not apply a tourniquet, cold compresses, or try to suck out the venom by mouth. Keep the person warm, reassured, and quiet until EMS providers can take over.
Hey, I just got bit by a snake down by that box.
Let me take a look at it.
A venomous coral snake bite differs from that of a pit viper. Instead of a single strike, coral snakes will chew with fixed fangs.
Okay, I want you to sit down right here,
Pain
okay?
and swelling at the bite site may be minimal or absent.
What did the snake look like?
It was red and yellow, had black rings on it.
It may be a coral snake. Let's play it safe and get some help, okay?
Serious effects are often delayed. When they do appear, symptoms can include abdominal pain, nausea and vomiting, rapid heartbeat, difficulty breathing, and drooling. The person may develop an altered mental state. If you suspect a coral snake bite, have the person sit still and remain calm. Activate EMS.
Dispatch, this is truck 55.
Go ahead, 55.
Adam's been bit by a snake at one of the boxes.
To slow the spread of venom, apply a pressure bandage around the entire length of the bitten extremity. Wrap toward the body. The bandage should be snug, but not so tight that you can't slip a finger under it. Immobilize the injured part and keep it below heart level. As with pit vipers, do not apply local cooling. Do not try to suck out the venom or use a tourniquet. These treatments are not effective and may be harmful. Keep the person warm, reassured, and quiet while awaiting EMS. Spiders typically inhabit out-of-the-way places, such as wood piles or outbuildings. There are certain spiders that can be dangerous to humans. These include the black widow and the brown recluse.
Ow!
Initially, venomous spider bites are often difficult to identify. Small puncture marks and bleeding may be seen. Tenderness, swelling, pain, itchiness, and redness at the bite site can develop. Over time, cramping, pain, and muscular rigidity in the body may occur.
Lisa, are you okay?
Probably getting sick. Well, something bit me.
A person may experience fever, weakness, nausea, and vomiting, or difficulty breathing. If you suspect a severe reaction from a spider bite, activate EMS. Keep the person warm, reassured, and quiet while awaiting EMS.
How's it coming along? Almost done. Hey, I've got a something crawling on my neck. Can you check it out?
Uh-oh. Looks like a tick burrowed in.
Well, can you get it out?
Sure. Let's go over to the truck so I can use a first aid kit.
Okay.
Ticks are blood-feeding insects that are typically found in tall grass and shrubs. When a tick bites, it attaches itself firmly to the skin. The biggest concern with tick bites is the exposure and transmission of infectious disease, most notably Lyme disease. To remove an embedded tick, grasp it close to the skin with tweezers or a tick removal tool. Pull straight up with a steady, slow motion. After removal, clean the area well with soap and water or a disinfecting wipe. When finished, thoroughly wash your hands. If portions of the tick remain in the skin or you develop a rash or flu-like symptoms, seek further medical attention. Do not use fingernail polish, petroleum jelly, a glowing hot match, or alcohol to remove a tick. These actions have proven no value and may cause additional problems. Stings from marine animals, such as fire coral, sea anemones, and jellyfish, can occur when a person is in or around the ocean
We
environment.
can see a lot of sea life in these tide pools.
Ow! That's stinging me! Ow!
Yeah, I think you might have got a piece of a jellyfish on you. I can help, okay?
Yes.
Okay, let's get you taken care of.
Stings can result in significant pain at the sting site and a raised, red, itchy rash. Wash the sting site liberally with household vinegar as soon as possible for at least 30 seconds to deactivate the venom and prevent further stinging. To help reduce pain, shower or immerse the sting site with hot water for at least 20 minutes or until the pain subsides. The water should be as hot as the person can safely tolerate. A stingray is a marine animal with a slender tail and venom-filled spines that can puncture the skin and inject venom.
What's wrong?
I stepped on a stingray and got stung.
Now, let me help you out of the water.
Thanks.
It needs to be taken care of. I can help.
Intense pain can occur at the sting site. Immerse the injured area in water as hot as the person can tolerate for 30 to 90 minutes to deactivate the venom and help relieve pain. Severe reactions to marine animal stings can include difficulty breathing, heart palpitations, weakness, and fainting. If this occurs, activate EMS immediately. Monitor closely and be prepared to quickly provide supportive care until EMS personnel take over. Human and animal bites can cause significant injury and bacterial infection. Bites from animals such as raccoons, skunks, bats, and foxes can also cause rabies. Left untreated, rabies is fatal. Control any bleeding with direct pressure. Wash the bite and flush with large amounts of water. Due to the chance of infection, any animal or human bite that breaks the skin should be evaluated by a medical professional.